Zollinger-Ellison Syndrome is characterized by the development of tumors, also referred to as gastrinoma, and excessive secretion of gastrin in the gastrointestinal tract. It is an inherited autosomal condition that affects 30% of people due to multiple endocrine neoplasia 1. The genetic cause really is unknown, but like I said, for about 30% of people, we know that it's due to multiple endocrine neoplasia. Some common medications used are AstraZeneca and Nexium to help with some of the symptoms of peptic ulcers in particular, excessive blood in urine, feces, heartburn, dizziness, all of the weight loss, feeling full when you're really haven't eaten much are huge signs and symptoms related to the disease. It's very hard to get a diagnosis due to the fact that they really do not do testing for this specific disease unless there is something off, particularly having a lot of gastric problems and peptic ulcers and low or high gastrin levels will make them say, hey, maybe we should take a look at this. The incidence for this disease is 1 in 1 million people are affected. Women typically find out that they have this disease from ages 20 to 35. Most people don't experience symptoms until the ages of 30 to 55. Men have a higher occurrence rate. Women experience symptoms earlier. For pregnant women in particular, every time you become pregnant, you have a 50% chance every pregnancy of passing the condition to your unborn child. So that is something to take into consideration before trying to give birth. You only have a 50-50 shot of not passing this disease to your kid. A lot of people don't understand the risk, and although there are a few people, about 82% are people that are successful with getting rid of this due to surgery, because sometimes in severe cases they just remove your stomach, or they're able to remove the tumors, and surgery is one of the most effective routes. In some cases, it's not so simple. They can't remove it immediately, so they resort to chemotherapy that helps. But with chemotherapy becomes more symptoms of nausea, vomiting, heartburn, hair loss, and just some things that can ultimately be avoided. Biochemical has become a very effective cure that many people have taken a stance on, and it's only effective to a certain percentage. Only about 30% people use biochemical cure and actually are successful with it. It has a higher instance to have a reoccurrence in like 5 to 10 years after receiving treatment for it. So Zollinger-Ellison Syndrome was very interesting to me due to the fact that it is inherited, and it's basically a disease that is so rare and so unknown that it only affects 1 in 1 million in the whole entire world. And about 0.3% out of 1,000 people know that they are walking around with such a rare disease that in some instances can be okay to live with, but in other instances you can die instantly and not even know the known cause.